Tip number 1, utilize your lactation specialist. As a new mom, getting help from a lactation specialist is very beneficial. They can help you with things such as breastfeeding positions, painful nipples, latching, concerns with milk supply, and mastitis. The lactation specialists are there to help you. Don't feel intimidated. Breastfeeding can be a learning curve for you and for your baby. This is known as the cradle position. This is known as the cross cradle position. This is known as the football hold. This is known as the laid back position. This is known as the side lying position.
Tip number 2, ensure a good latch. These videos show the inside of a baby's mouth and why a good latch is important. When the baby takes a big mouthful of breast and the nipple is pointed towards the roof of the mouth, the nipple reaches a point deep in the baby's mouth, enabling the baby to suckle more effectively, triggering the milk to flow. In comparison, a shallow attachment is where the baby only suckles on the nipple and the nipple is centered in the mouth. This causes the nipple to land under the hard roof of the mouth, and as the baby suckles, the nipple gets pinched, causing pain. The baby is also unable to suckle effectively and is unable to get a good amount of milk.
Tip number 3, establish good breastfeeding habits. Establishing good breastfeeding right off the bat is a good way to avoid problems with your own milk supply. Frequent breastfeeding 8 to 12 times in the first day of birth will help empty the breast more frequently, which will help stimulate milk production. Breast milk production works by supply and demand. The more you feed, the more milk the body will make. Following your baby's lead and feeding as frequently as they demand will help your body know exactly how much milk it needs to make to meet your baby's needs.
Tip number 4, watch your baby for hunger cues. You can watch your baby for cues on when they are hungry. Crying is actually the last cue that you should notice when your baby is hungry. Once they start to cry, it is harder to calm them down and get them to latch and feed. Watch for cues such as the baby having their hands by their mouth or rooting, which is searching for a breast, as shown in this video.
Tip number 5, remedies for sore nipples. Some tips for sore nipples include contacting your lactation specialist to see what you can do differently. Some things that you could start doing now include applying your own milk onto your nipples. There are healing properties of breast milk that will help. You can also apply lanolin ointment and use nipple shields. The main cause of sore nipples is incorrect latching. Fixing this problem will help to ease the pain. Ensure not to confuse this pain with mastitis, which mainly affects breastfeeding women, causes redness, swelling, pain, and you may also have a fever and chills. Mastitis is an inflammation of breast tissue that sometimes involves an infection. Some remedies for mastitis include antibiotics, warm compress, light massage, taking acetaminophen, drinking more fluid, and getting lots of rest.
Tip number 6, maternity leave. Before you go on maternity leave, talk to your employer about their breastfeeding policies. There's a Federal Pregnancy Discrimination Act that requires employers to provide their lactating employees to give break time specifically to pump in a private area. This private area does not include the bathroom. They are required to do this until your baby is at least 12 months of age. Here is a link which shows your rights as a breastfeeding mother in your workplace.
Tip number 7, offer yourself some grace. The last tip is to offer yourself some grace. Be patient with your body, be patient with your baby. If breastfeeding doesn't work for you or for your baby and you're giving it your all, it's okay. It's not anyone's fault. There are other amazing options in today's world. If you need to switch to formula due to low milk supply or any other problems, you're not alone and you have support.